We've had some more people join. I want to take this time and invite you to the, welcome you to the 2020 Promise Zone Federal Convening. Again, welcome to the 2020 Promise Zone Federal Convening. We will get started 5 minutes after the hour. Today's topic is economic mobility, paving the path to self-sufficiency. Greetings. We've had a number of people join us. Welcome to the Promise Zone 2020 Federal Convening. Again, welcome to the Promise Zone 2020 Federal Convening. Topic today is economic mobility, paving the path to self-sufficiency. We will get started in 4 minutes. We've had a number of people join us, and we want to take this time and welcome you to the 2020 Promise Zone Federal Convening. Today's topic is economic mobility, paving the path to self-sufficiency. We will get started in 3 minutes. Greetings, everyone. We've had some more people join us this morning. Thank you for getting on with us today for our 2020 Promise Zone Federal Convening. We will get started here in about 2 minutes. Today's topic is economic mobility, paving the path to self-sufficiency. We'll get started here in about 1 minute. Okay, guys, we're going to go ahead and get started. We'd like to welcome you again to the 2020 Promise Zone Federal Convening. Today's topic is economic mobility, paving the path for self-sufficiency. We would like to go over a few house rules really quickly. We will ask for this presentation specifically that you stay on mute until you're asked towards the end. There will be an opportunity for you to use your raise the hand portion of your chat where you can raise your hand to ask a question, but until then, we would ask that you put your questions in the chat format, and those questions will be reviewed by team members, and we'll be relaying those questions to the presenter. But the presenter has asked for some feedback for this presentation from the participants, so we've decided to allow that at a given time. We will notify you when that time is available for you to ask those questions directly, but you will have to use the raise the hand format on the Zoom platform. So please do not unmute yourself until you're asked, or we will be the ones unmuting you at that particular point in time. But the presenter has asked to allow some conversation back and forth because of her presentation is geared towards feedback. So we will again say keep all computers on mute until otherwise requested. We will notify you at that particular point in time by you using your raise the hand button. And at that particular point in time, we'll go ahead and address the questions from the presenter. But we will let you know when that time comes about. But until then, please keep your computers on mute as we go through this presentation. Lisa, I turn it over to you, our moderator, for this presentation today.
All right, thank you, Silas. Good morning, everyone. I'm Lisa Nowinski. I sit in the Philadelphia HUD field office, and I'm excited to moderate this panel today. So just a quick overview. We have Erica Fleischer with us from ACF, which is an office of HHS, Health and Human Services, and she is a program specialist in the Chicago office and primarily works with the Midwest region. And she is going to go over the economic mobility program that she works on, and that is focusing on helping families become self-sufficient. And it is a partnership working with the Department of Labor and their Employment and Training Administration. So the focus is to bring childcare to individuals in the workforce, as we know that is a huge barrier. And also she will be discussing best practices that have been found from this program. She's going to start off with just a presentation, but it's highly encouraged that after this presentation that questions and a discussion happens, because she believes that this is the best way to learn and to learn from each other. So I'll hand it over to Erica.
Thank you, Lisa. So as Lisa said, I'm Erica Fleischer. I work for the Administration for Children and Families in Region 5. And today I will give you some background about ACF and our regional office that I work in, as well as the initiative that I've been spending the bulk of my time working on the past few years, economic mobility. So ACF, we have all our work guided by the vision of children, youth, families, individuals, and communities who are resilient, safe, healthy, and economically secure. And we have several programs in Region 5 that are funded, either we fund the states or directly to the grantees. So those programs are child care, child support, child welfare, Head Start, refugee resettlement, runaway and homeless youth, and temporary assistance for needy families, or TANF, which is the cash assistance program. Beyond those grant-funded programs, I work in the Office of Regional Operations that focuses on the ACF policy priorities and special initiatives. And some of the policy priorities we've been working on over the past few years are promotion of work and self-sufficiency, promoting fatherhood in human services, focusing on early childhood education programs, primary prevention and child welfare. And I also want to add to that that recently the Assistant Secretary has started an all-in foster to adoption initiative to encourage adoption of youth from foster care. We've also been looking at data and interoperability and removing barriers and streamlining processes and reducing duplication in human services. And a little bit about how these strategic initiatives work. We have the ACF Central Office, which provides the strategic vision and leads these cross-program priority initiatives and promotes partnerships on the national level and provides guidance for the strategic plan and support. In our regional office, we implement our regional strategic plans, we identify innovative practices, we promote state and local partnerships and facilitate state and local learning. So this presentation and my work over the past 3 years with the Promise Zone in Evansville, that comes in that area. And then states and territories, we incubate innovative policies and practices, leverage resources to implement and sustain initiatives, engage local communities and families, and peer learning and sharing. And one thing that's important is we have a policy to practice feedback loop and continuous improvement. So we take the information we get back from states and territories, we're able to change and adapt and learn from that. I also wanted to give some basic information because this always comes up when talking to Promise Zones. But for ACF grants, some of them do go to the states, and there are some that go directly to grantees. And the best way to keep track of ACF grants, or really any federal grants, is to go to grants.gov. You can set up alerts, you can search. And I always bring up this one because it seems to always be the most appropriate for the work that the Promise Zones are doing. But in our Office of Community Services, we have community economic development projects, and it is a discretionary grant to community development corporations. And they're for innovative projects to enhance job creation and business developments for individuals with low income. So the announcement did close for this year, but it is a standing announcement that is up every year. So if that is relevant for your Promise Zone, then you should look into that in the future. What I want to spend the bulk of my time today discussing is our economic mobility initiative. And it started in 2018 with an executive order by President Trump to reduce poverty in America by promoting opportunity and economic mobility. And it's really for us to rethink welfare, rethink public benefits, rethink how government is working together on these issues. And ACF for several years had been working on these issues, but this is how we really defined it as economic mobility is what we were working on. So one of the ways that this is manifested itself is through a Council on Economic Mobility, and this is on the central office, DC office level. So really the challenge here is that there's fragmented and siloed federal programs, and there's 43 different federal employment and training programs and 92 different programs for people with low incomes. And you can imagine this creates a system where everyone has different program goals, there's different funding streams, they're approved by separate state and federal regulations and allocated through different mechanisms and funding formulas. The administrative structures are different, the eligibility and income rules are different for every program. Performance measurement is different. We often hear one of the issues is that in WIOA, in the Employment and Training Administration programs, they're measuring the outcomes, and that in TANF, the Temporary Assistance for Needy Families program, they're really measuring the inputs and hours as opposed to what happens to the people in the program. And it creates administrative burden, inconsistency, and duplication. So this council was created in fiscal year 2020 budget, and it directed HHS to lead the development of the Interagency Council of Economic Mobility. So our Secretary of HHS, Alex Azar, is the official chair. And I wanted you to see this whole range of different departments that is participating in this Council of Economic Mobility, including the Department of Housing and Urban Development. So the council is working on 3 different areas, clearing a path to economic mobility, and that's really working across all the sectors of government to focus on the programs and policies on promoting economic mobility rather than hindering it, making government work better together, institutionalized processes for interagency collaboration among council members, for council businesses, and streamlining communication with public and private stakeholders. So this will make the council a forum for 2-way information sharing with stakeholders, and stakeholders include state and local governments and non-government stakeholders. And I do want to say also that the council is now asking states for feedback on some of these issues. And I know they're doing that both written and that they are starting to hold listening sessions around the country. So here in Region 5, one of the things we do, as I said, is we gather information about innovative projects in our region. So I wanted to describe 2 of them to you. One is in the state of Ohio, and it is known as CCMEP, which is the Comprehensive Case Management and Employment Program. And it is for low-income people ages 14 to 24, and it's a combination. It blends TANF and WIOA funding. And I think I mentioned before how there's often this conflict about TANF and WIOA and measuring different things. So I know that what the state of Ohio told the counties is to focus on these services to people, the paid and unpaid work experiences, the career coaching, the education and career training, and supportive services, including transportation, childcare, and housing, and to really take a holistic approach and focus on meaningful training and employment programs to lead sustainable careers. So they're taking this holistic approach and using these things, still able to meet the work participation rates required by TANF. So, and they are doing evaluations of this program through, I believe, Ohio State University, and so far have had very positive outcomes. Another promising program is called Pathways to Prosperity and Wellness, and it is in Minnesota. It's a pilot program with 2 counties, Olmsted and Dakota County. They started this program with 100 families, and it adds flexibility to benefits received through various state and federal programs. They use a comprehensive family assessment and benefit cliff calculator, and they use foundation funds and state funds to supplement federal funds that come with stricter restrictions. Their ultimate goal, which I don't think has been fully realized yet, is that they want people to be able to get a universal benefit that will be able to address their specific needs at the time and not be restricted to, you have this many dollars for childcare and this many dollars for housing and this many dollars for food. So I just wanted to show you, this is out of Minnesota, where they looked at the benefit cliff. And this is something that everybody faces with benefit programs. And you can see it first, as income increases, people are better off. But then as programs end, they go, there might be little dips of how much money a family has. And then you can see at the first red circle, there's a big drop off on how much money a family has. So, and you can see this is at about the income of right before an administrative assistant. So here we could be helping families gain work and the skills to be employed. And as they lose their benefits, they're actually worse off. And we've heard examples also of people telling their employers, asking not to get a raise because they will lose their childcare, they will lose their health care. So this is something that impacts people. And one of the things that the program Pathways to Prosperity is aiming to do is to, 1, make people aware of this cliff, cliff, and then to be able to smooth that cliff with supplemental funds so that people can improve themselves and take better jobs and get raises and not be worse off for losing their benefits. So I don't have a slide for this, but I do want to tell you one more thing that we've been doing in Region 5. Every year we have a economic mobility summit where we bring state human services and state workforce people together and they work on strategic action plans on something in this area of economic mobility, and to bring human services and workforce together and to use a whole family approach. So our next one will be in October, but just know that between Region 5 and Region 7, this is something we work on every year. Now, as Silas said, I believe I am going to now open this up, and I really want to hear from people. What do you think family self-sufficiency and economic mobility look like, and what do you think we can do to help families get there? And I'm going to have a few slides of questions to sort of continue the discussion. So anybody, well, first I should ask, were there any questions in the chat? Lisa, are you able to see that?
So there was only one comment, and that was from Judy Shanley, and she just mentioned that you would think that the Department of Transportation would be a part of the Council on Economic Mobility, since transportation can be a barrier.
Yes, and I do think, because I know there's been a few different agencies when I've heard people talk about this, and I do think that in the future they may look to expand who's on this council. I believe this is just what has started. And then
yep. Sorry.
Go ahead.
I thought you were done. We did just get a question, but did you have something else?
No. I saw the question. So go ahead. You can read it off for everyone.
Our employer, and this is from Trika Henry, are employers in this discussion yet, in particular for pushing for more living wage jobs to eliminate the benefits cliff?
So employers are in the discussion. I will tell you, probably from our perspective at ACF, it is something we could do a better job at. I know we spoke a year ago at the Michigan Workforce Association. I think it's the Association of Workforce Boards in Michigan, and there were several employers at the presentation, and they were able to talk about some of these issues that they have seen that people have faced. And I do know that employers are in the discussion. I know Judy Shanley with transportation, and some of them, I have heard examples in certain states where employers will be able to set up transportation to help get people to work, to address childcare. But yes, it is something we can do better.
Great. And then there's a comment from one of our CLs in the North Minneapolis Promise Zone, who describes how in Minnesota, they do engage with transportation and transit-oriented development partners, but they tend to be more of the state and region organizations that receive the federal funding. So thank you for that. I did have one quick question from myself. So you mentioned the Economic Mobility Summit and that you participate in the Region 5 and Region 7 one, but we do have individuals here from all across the country. Are there summits happening in other regions that work on a strategic plan, or is this just something that you guys have focused on?
So every region does things a little differently. We are all working on economic mobility, but on how they do that, in what form. So this is one of the things we have done for Region 5 and Region 7 the past 3 years, and not all of the regions are doing that. I know Region 1, together with Region 4, has done several convenings.
Okay. So another question that just came through is, how does the innovative an innovative initiative, an initiative in corporate planning and development for affordable housing or other strategies or policies to make housing more affordable, especially in high-cost areas.
So I will also tell you housing is probably not one of the areas that we have given enough attention to. And I think part of where the disconnect happens for us is we on the federal level are working with the state leaders, and a lot of times the housing issues are more on a local level. And that is also something that I do think we need to think about more, because obviously housing is a huge expense for families. So we have been much more focused on work, helping people obtain work, helping people manage benefits, helping states integrate their different programs on childcare. These are the sort of the issues that have come to attention the most. And I definitely think, you know, as we're talking more focus on incorporating housing and more focus on our private sector partners is important.
Great. And then just for all of those that aren't active in the chat box, someone did just shared the link to request for information on federal coordination to promote economic mobility for all Americans. So that link is in the chat box if you all want to take a look at it.
Great, thank you.
And right now I don't see anything else, so.
All right, well, if anybody would like to raise their hands and talk a little bit about what self-sufficiency and economic mobility mean to you, I'd like to have a little bit of a discussion. And I do have some more prompts if this is not the one that is going to spark ideas. And can you see, Lisa, if there's any hands raised?
No, there's no hands raised.
Okay.
There are none, but there is a question.
Yep.
Are apprenticeship programs involved in the job training section?
Yes, and I do know that apprenticeship is an important thing that has been encouraged by this administration. So yes, definitely apprenticeship. I do see a hand raised. Paula?
Yes, hi. I tried to send the message to the chat, but I think there's something wrong. My question is, are companies with community relations doing better in achieving family self-sufficiency? You know, for instance, so I'm in South Carolina, like let's say Volvo or BMW, they have community relations and they partner with hospitals or transportation systems. Do you have access to data showing that those companies highly involved or with this program are doing better with that?
I do not have any data. It's something I can look into. I will say that there are things called employer resource networks, and I believe business resource networks. I know Michigan has been a leader in that area, and that takes smaller businesses that might not have the resources to put together services for their employees so that they can provide them with childcare and mental health services and all of those things. And I do believe there is some research on the success of that, but of community relations, I don't know. It's something I could look into and get back to you.
Thank you.
I do not see any other hands raised.
Okay, well then I would like to hear, so for those of you who are in promise zones or elsewhere, I would like to know examples of promising and innovative approaches that you've used, because this is a large part of what I do, is gathering this information. And even if you are not in my region, I can share those with my counterparts in the other regions. And examples of that are whole family approach, health and human services integration, using cross-sector strategies and public-private partnerships. So any of those things. And I know we had a little bit in the chat talking about transportation and so forth. But if anyone has anything that they are willing to share, I would love to hear about it.
Okay, I'm not seeing any hands raised.
Judy, Shanley, can I call on you? Can you talk about some of the good things you've done? Are you still there? No, I don't know if she's still there. All right, I don't see her name. Okay.
Hey, Erica. This is
Yeah.
Jake Akervik with Minneapolis.
Yep.
The North Minneapolis Promise Zone. I will say, and this was prior to the Promise Zone, but Department of Education used to have the Promise Neighborhoods program, and that here in Minneapolis funded what was called the Northside Achievement Zone, which is a wraparound services model that has been incredibly effective. It's centered on education, educational partnerships, obviously, but providing that physical location, that one-stop kind of connector model for those kids and families has been incredibly effective in North Minneapolis. And, to hook that to some of the things that HUD is doing, Secretary Carson has the Envision Centers initiative, which is another place-based model that's focused on a physical location, such as a nonprofit or a housing authority. That coupled with other place-based and collective impact models like the Promise Zones, where instead of focusing on the direct end user, we're really focused, at least a fair amount of us, I think, are more focused on the nonprofit, government, and philanthropic partners and stakeholders. I really think, to me, that's the future of the model, is trying to figure out how to weave that together and how to weave the program improvements and the federal funding stacks together to be more effective in conjunction with the state and local funds. But honestly, if we want to have, if we want some real talk, one of the things that's frustrating, I think, for me, and I know other colleagues, is that we talk a lot about program evaluation and program improvement, but we really don't, in my opinion, adequately fund staff and our grant recipients for those activities. And so that's one of the discussions I would like to see at some point, is how we can better, take the resources we have and actually measure some of these outcomes definitely more effectively, but also just have the discussion about what do those funding and staffing levels need to look like to actually be effective in measuring those outcomes.
Yeah, and I do think ACF has done a pretty good job. We do have our Office of Planning, Research, and Evaluation that I know is able to fund some of this research. And then, I mean, we've just through all our programs, there's been a real focus on evidence-based and outcomes. I know for child welfare, for that Family First prevention program, everything needs to be evidence-based and shown. But of course, funding is always an issue to show these things. And some of these things I'm calling, promising as opposed to best practices, because they haven't been proven yet, even if the research is happening.
Yeah, no, that's a fair point. I appreciate it.
Yeah. I saw Jessica Wilson was raising her hand.
Yeah, I was wondering, I think an example that you might be looking for too is, I know in Southern Indiana, Evansville area, Silas has been doing a really great job. They have different work groups going for a lot of different agencies that get together on different topics that they could influence. And then one of the things that I've seen that has affected what I do the most and has been very impactful is they created an app that shares resources and events and different things that are going on within the Promise Zone. Is that kind of what you're looking for as an example?
Yeah. No, I mean, any of this kind of work, and the app has been successful and well received by the community?
Oh yeah, absolutely.
Yeah. Thank you, Jessica.
So my chat is also disabled. So I have a question.
Yep.
From a lot of our public sector, not public sector, our nonprofit partners, that some of their challenges are just even reaching out into the community. Not the outreach, but getting connecting with people. You know, even though they may have been in the community, the organizations may have been in the community a long time. So you know, it's great to provide the services, but having people take advantage of those services, feeling comfortable, feeling connected. So if there's any best practices in terms of how do you make sure that you're reaching the right people? Appreciate hearing about those.
Yeah, and I think the best examples I can think about those are navigator programs or home visiting programs. So the home visiting programs, again, often are these evidence-based models that the different states have, and there's funding through the maternal, infant, child home visiting. MICV is the acronym. So I know that there's been a lot of success with those programs of engaging mothers and children. I also can think of an example where they did this in Madison, Wisconsin, and they have a program there in partnership with the city and with the United Way and funding from the Renenbaum Association. And they did hire sort of navigators, community navigators, to work in the community and recruit people into these programs and services. So that, I believe, is really sort of the best practice, is being able to hire members of the community. And they also, in Madison, they were hiring these people to be navigators, and at the same time training them in a public health outreach worker certification program. So it was providing them a career ladder that eventually they'd be able to use this as also a way of gaining employment.
Great, thank you.
Yep.
Okay, there are no questions in the chat box, and I do not see any hands unless Jessica Wilson had another question.
So my next question was actually related to what Susan was just asking about, but what do you think really are the greatest barriers or pain points for realizing the shared vision and improving outcomes in the promise zones? So we know one is outreach to the community, but what else is really kind of the pain points that we could work on addressing to make things better? And Jessica Wilson, raise your hand again.
In our area, I would say one thing that I think could help improve and even get more buy-in, especially from the community outside of the people that are needing the services, you know, is just more publicity, or I don't know how to word it. I just know that a lot of people in our area have never heard of the Promise Zone, or if they've heard of the Promise Zone, they don't really understand what that even means.
Yeah. So more education about the Promise Zone.
Yeah, because it's almost like if you're a part of a nonprofit, then you're probably going to know at least the basis of it. But if you're not part of a nonprofit, then that's where the disconnect kind of comes in.
Thanks. I see Jake also raised his hand.
You know, and I know this is a tough one because it's a dollar ask, but I think those community economic development projects grants are really great, and I would love to see HHS fund more of those types of projects and grants but also bring back the more food and health focused version of that grant that seemed to get merged in with the primary grant a few years back. Because food insecurity is such a huge issue in these neighborhoods, and having that separate funding pot just specifically for that type of economic development project, I think was really cool and really could is a high need in these communities.
Thank you. And I do see, oh, we have someone else raise their hand.
Johnny did.
Okay.
Hi. So just to piggyback off of what Jake was speaking about as far as definitely food deserts within the Promise Zone. I represent the Promise Zone here in Atlanta. And I'm hearing also there's still a disconnect with a lot of community partners inside the footprint of understanding how these resources work and who would be the best as far as matching up community partners with certain opportunities. So I think, and this isn't just for this program, but I think for federal partners that are offering assistance is maybe just, we have to figure out a way to connect the dots better for these partners to make it easier for them to access. Because what I'm finding is a lot of them are finding it too difficult. And so they'll go to a community quarterback where there's not as much paperwork, or the process is a lot shorter to get to the funding. So just trying to, I mean, I know this is a consistent issue. I've heard it several times, just trying to still get different perspectives on how we can close the gap on that.
Yeah, and I'm hoping that that's something that the council can work on, because they are trying to address some of those barriers and duplications. And I do know that it is much harder to get federal funds than, from nonprofits or so forth. The grant process is much harder. Lisa, go ahead.
There are a few comments
Yep.
in the chat box related to your question on barriers. So
Yep.
Do you want me to just kind of do a recap of them for you?
Yeah, why don't you read them off?
So number one, there are gaps in agency language. So every agency might use the same word, but it might mean a different thing in their world. There are a lot of federal restrictions for small grassroots organizations, making it hard to access funding. And a lot of the programs and funding streams that the federal government has to offer can be overwhelming for staff, especially those in a small organization. And for those that are in a rural promise zone, the competition between rural and urban can be difficult.
Yeah, and I do think, so the issue of different language is something we deal with across, I know we deal that across federal agencies, and also hope that the council can address that and give us some more standard language to start with. So yes, we talked about the federal restrictions, and then marketing on the Promise Zone and transportation. So Judy Shanley, I know she gave a presentation, I believe it was given already, but she is a great asset. The Department of Transportation, Federal Transit Administration, has different people across the country who provide fabulous technical assistance on these issues and can help you think about the transportation issues in your Promise Zone. And yes, I mean, the funding streams are overwhelming, and that's definitely something we need to do. It's very interesting of the rural versus urban issue. There are a few grant programs that come across that are specific to rural areas. I know the USDA has a lot of them, and I would definitely think about those to sort of help up and prop up your areas. And I do know that there's different issues in the rural areas, and that transportation is more of an issue, and childcare deserts are often an issue in the rural areas. I know there's states that are doing different things to adopt those. And I am just going to keep sort of reading these and addressing them. More strategy around program alignment and community organizations, government agencies would make the work easier. Absolutely agree. That's what we're working on. The Envision Center in San Antonio, East Side Promise Zone, started providing food distributions, which bring many people to the center, at which time they're informed of programs available there. So that is great as a promising practice. Promise zones leverage multiple funding programs from federal and state partners. Each has different funding terms, metrics, and requirements. So when federal agencies award funding for one grant, they want to measure output and impact of one grant. But much of the work in promise zones is not just the effect of one grant, but collaborative, collective impact efforts. Agreed, and I hope that there is some evaluation of the promise zones as a whole, because that is really what we want to measure, is the holistic approach that you're taking. People need easy access to affordable healthcare services so they can stay in training programs, schools, jobs. Some areas are healthcare deserts or options are very limited. Yes, so healthcare, just like childcare in these rural areas, are a problem for people. One very interesting thing that has come about this, I was talking with Jennifer Sullivan, who is the FSSA secretary in Indiana. She said that due to the pandemic and the increase in telehealth, that people were actually attending their medical appointments more often. So it's one of, so, you know, there's a whole other issue of digital inclusion and getting people access to the internet, but in some ways it does make access to things like healthcare a little easier for people. This is great. Thank you for all these comments and questions. All right. Jake, funding application complexity is also a challenge. We tend to reward the larger and more experienced organizations because they know how to get funds and what federal grantors want to hear. That means that some newer organizations and potential better models and projects may not be getting funds because they sometimes tend to focus on dotting the I's and crossing the T's versus funding new organizations and innovative ideas. So yes, that is a problem. And I don't know, again, on the federal level, what we're doing to address this, but interesting that so again, in conversation with, this time with Minnesota, they were talking about some of their funding criteria during the pandemic, and they were trying to take an equity lens to fund organizations that maybe haven't been funded before, but had better outreach to the community and the populations they were trying to reach. So that is one way of perhaps offering access to newer organizations. I realize this is a pie in the sky type of idea, but like Envision Centers, trying to follow a model where services are under one roof. If agencies could also follow the under one roof model for collaborating, this would be so valuable. It would literally be a step in the right direction for getting all the right people to the right table for improving programs. And I do think this is the model that the council is trying to take, of getting the people under the right roof. Okay, Jake. Also North Minneapolis. North Point Health and Wellness brings multiple services to one location: medical and preventative care, a food shelf, and a farmer's market. So another good example of a one-stop shop. Another challenge is that neighborhoods change. Some promise zones are neighborhoods of historic and generational poverty. Others are communities of newly arrived immigrants living in poverty. Tracking people versus looking at data in neighborhoods can be complex. And yes, I understand that as neighborhoods change, that you're looking at different people. Okay, next one. Good stuff. All right, so one of the things I'm going to do is I am going to copy this chat and all of your comments about barriers. I'm going to make sure that I have those, and I will be able to share them with my boss, Angela Green, who's the regional administrator, and my colleagues, the other program specialists across the country, just so that what's important for us, again, is this feedback loop, that we're able to hear from you on the ground or closer to the ground that we are, of what the barriers are. So I really appreciate all this feedback. So the last question, if anybody would like to talk about what do you see as priorities for your organization to help families on their path to self-sufficiency? Is there anything that's sort of been brought up today? If you could choose one thing you'd like to work on to address to help your community, what would it be?
Currently no hands raised, but the chat box is open.
All right. And Jake, can I call on you, since you seem to be, you have a lot of opinions on this.
Oh, I'm sorry, I was distracted. What was the question again?
Oh, the question, so if there's like 1 to 3 priorities for you or your organization to help families to self-sufficiency, or if, you know, you're talking about Promise Zone in Minneapolis, what do you think, like, what's one thing you think that your Promise Zone should do?
You know, you brought it up with one of your last comments about the practices in Minnesota. And here, you know, if you look at Minnesota, not just Minnesota, but the surrounding Midwest and upper Midwest states, our racial equity data, it stinks.
Yeah.
And we're really not gonna make progress, in my opinion, until we address the racial inequity that's happening with a lot of these issues and programs, because it's a real thing, and the data bears it out. So that's you know, it's easier said than done. And part of that, I think, is also bridging the socioeconomic conversation between the rural and urban areas that are experiencing some of the same issues, because I think we're also being divided along these rural urban lines when there are a fair amount of shared issues between you know, urban poor BIPOC communities and rural poor white communities. And I think we need to get more real about that conversation. So that would be one of my priorities, is opening up more conversations between leaders in those regions to really get together and talk about the shared problems instead of duking it out over the root causes.
Thank you. That's very helpful. And I see we have more things in the chat right now.
And we do have a hand raised.
Okay, so call on the person who has their hand raised.
Apologies, but all I see is owner, but feel free to speak up.
Professional. I live in Atlanta. I live in a historic community, and I was the director of a single parent training program at the technical college. One of the barriers I see that we still have to really address is the health and nutrition of the single parents. Atlanta had their housing properties demolished 20 years ago. And so that population has been scattered, but they are returning to the city. And the housing choices and nutrition choices have to be made. And I have just observed some of the single parents not making very good choices in the grocery store. And you can't work if you're not healthy. So that goes hand in hand. And I think we need to do more with promoting the health and nutrition of young children. You can't learn if you're hungry, but it also, you know, we all know that it affects brain development. And I'm a community advocate. And if I had my way, I would just eliminate food from gas stations and convenience stores, because it's not nutritious. And somehow we've got to attack that. There are food deserts, but there's transportation, and we are making progress on eliminating food deserts, but still the information, the nutrition information and health information has to continue. And luckily I live in an area where there is the Morehouse School of Medicine, and they are doing a job with community health. So we need to keep that out there, that nutrition and health for the working parents is a priority.
Thank you. And we are almost out of time, so I am just going to read the comments that are already here, and then I'm going to leave you with my contact information. So we have incentivize more equitable development across our communities for affordable housing. Many people would take advantage of workforce training programs that provide stipends. Training is good, but folks have to be able to pay the bills. Yes, that is very important. Continue to have data sharing agreements with school district, colleges, and employment data to track the cradle to college and career continuum in the Los Angeles Promise Zone. And yes, data sharing is very important, and kind of a long process that we're looking at ACF is sharing data and what our restrictions are. And our former acting assistant secretary had issued a memo that said, you know, we are doing the answer is yes, we are trying to share the data. You know, it's only in these few cases of restriction that we can't do it. And Jake did say they are trying in Minnesota to apply a racial equity lens, and also put a link in there about nonprofits led by people of color win less grant money with more strings. So that is something that Minnesota is specifically trying to address. So I want to thank you all for your time today and for your discussion. As I said, that was really important to me that we were able to do that. And here's my contact information. You can feel free to email me if you need contacts within, you know, your different regions. If you are not in the Midwest, I'm happy to provide those to you. So I am going to end with that. Lisa, if you just want to close this out.
So thank you for your time, Erica, and thank you for everyone participating. I'll hand it back over to Silas and our other hosts if there was any closeout information that you needed to share.
All right, everybody, we want to thank you for participating with us for our 2020 Promise Zone Federal Convening in this presentation for economic mobility. We do want to say that we do have another one starting this afternoon for AmeriCorps National Civilian Corps, Community Corps, or our VISTA programs as well. So if you're interested in that, and then tomorrow as well, we will have a number of presentations, EDA, the Department of Education, and a re-entry panel as well. I will say this, if you use your login that you got into with this meeting, will work tomorrow and this afternoon if you were unable to register. So you can use this login again to get back into any of those meetings today or tomorrow. But we'd like to see you definitely, even if you did not register, log into those meetings. So thank you again, and we hope to see you this afternoon or tomorrow.
Thank you.